others, they forget to prioritize taking care of themselves. And I know we have a lot of busy moms back there probably thinking the same thing, but as we welcome Women's Health Month, we want to remember that preventative screenings, checkups, and early detection saves lives. For our young women, here's what that looks like. It looks like cervical cancer screenings annually beginning at age 21 and STI screenings annually. As you enter your 30s, it's time to talk about breast health and begin getting your cholesterol checked. In your 40s, mammograms are recommended every 1 or 2 years, depending on your family history. It's time to start thinking about colon cancer screening and talking about menopause. And in your 50s and beyond, bone screenings, lung cancer screenings, for those with a smoking history are really important. But these recommendations are just starting points. It's important to talk to your provider about your family history and other factors that may increase your risk of certain illnesses so that you can adjust screenings and checkups if they're needed. No matter what your age, these regular appointments are too important to skip. I know that medical appointments can feel sometimes intimidating, sometimes can cause anxiety. I know everyone loves getting mammograms, right? And sometimes it could be awkward, but it's so important that you find a provider that's talented, trustworthy, and one that provides compassionate care and that will work with you to create a safe space and protect your health. Women's Health Connecticut has been a fantastic partner in our efforts to ensure that women not only have access to these appointments, but feel safe and comfortable when they're getting their care. So check your calendars, and if you don't already have an appointment scheduled, let this be your month to get that done and make sure you're on a path to a healthy future. And with that, it is my pleasure to introduce our host, Women's Health Connecticut President and CEO, Paula Greenberg. Paula, thank you so much for having us. We appreciate it.
Thank you, Lieutenant Governor and Commissioner Giuntani. We are so pleased to be here. And I have to say, Connecticut is #1 for working women. And
yes, it is.
We are so proud of that. And we're proud of the efforts that the state has done to address some of our key women's health issues: endometriosis, menopause, family leave, intimate partner violence, and support for our Medicaid population as well. And those are common goals that we have with the state of Connecticut and our network of 200 physicians and 100 advanced practice providers. We focus on inclusive care and meeting patients where they are. We need to hear and validate their concerns and be a partner with them as opposed to giving them direction and care. We have great access, as I said. We have an after-hours care program. We have a birth center, one of the only ones in the state of Connecticut that's freestanding. We also offer mammography and lab services that have a very rapid turnaround and performed in our offices, making access that more easy for that one-stop care. May is a great time to address preventative care and putting ourselves as a priority so that we can continue to do what we do best, which is care for others. We also need support and encouragement to our Gen Z, our 13 to 28-year-olds, to start a relationship with an OB/GYN provider. They often seek care from a source on their mobile device and miss key screenings, as you've mentioned. The discussions on symptoms they experience are keys: painful periods, PCOS, and endometriosis. And now we can address those with them virtually in our virtual care program. We know that connecting with this group is difficult, and our commitment to address their needs using both the virtual care program and also the behavioral health program, because many of these young women post-COVID seem to be more anxious than, or admit their anxiety to us. We want to thank the Lieutenant Governor for teaming up with us to support our mission that every woman in Connecticut deserves the best care possible. Thank you.
Thank you so much, Paula. And thank you so much for recognizing that Connecticut has been touted as one of the best states in the country for women and families. And one of the major reasons is not only our great paid leave program, but also what we've done to ensure that all women have access to mammograms. We've also been working on making sure that we have the best maternal care, especially in vulnerable communities. So we so appreciate your partnership, and it is my pleasure to introduce our very distinguished Public Health Commissioner,